Good evening, I'm Elizabeth Cook.
I'm Alan Martin. We're going to start with how the Bay Area is reacting to the Omicron threat.
The new COVID variant hasn't been detected in the U.S. or the Bay Area yet, but KPIX5's Shawn Chitnis says health officials and the public are taking this new strain very seriously. Shawn?
Liz, that's right. They were certainly talking about it at this clinic that is just wrapping up here in Contra Costa County, where the vaccination rate is around 86% for those who are eligible. They certainly want to see that go up. That's why they have the clinic. And those who are studying this latest variant tell us they are hopeful that the vaccine will continue to prevent severe disease and people dying from COVID-19. Parents brought their children to help get their entire families vaccinated at the Oakley Rec Center. Others in the community came by to get a booster shot, a decision they made before hearing about the new variant.
Sounds like it can be pretty bad. I mean, it hasn't been around long enough for them to really know a lot about it.
Parents already knew their kids needed the vaccine too, but for those who work at a hospital, Omicron only confirmed that this was the right call for their children.
I was scared, I was stressed out, I was shocked.
County health leaders say so early into the study of this variant, vaccines remain an important tool to controlling the spread.
It's clinics like this today that really are in the neighborhood, where people go, where people are familiar with, that are so important to really reach those people who still need to get vaccinated.
What should people be doing to react to this latest variant?
I think that the recommendations continue being the same.
So far, experts say we need to keep following the response we've had for COVID-19. The Delta variant showed us that the approach has to be aggressive.
There's not a single intervention that will be sufficient to prevent transmission. So you need to do ventilation, masks, vaccination.
And Omicron may confirm what some already suspected. The virus will remain a threat.
I don't think that we are going to make this virus go away. We need to learn to coexist with it and defang it, make it as mild as possible.
And the vaccines are part of how that will happen.
If you want things to get back to normal, you got to do the normal thing and get vaccinated.
Now, Shawn, you were telling us earlier, not everybody excited about the vaccine clinic opening up today?
That's right. We saw about 10 people show up with signs against the vaccine, trying to convince people not to go into the clinic. One person even had a megaphone to try and spread claims, again, against the clinic and anyone trying to get the vaccine.
First Amendment rights. All right. Shawn Chitnis, thanks so much. While we wait for more details on the Omicron variant, health officials agree what people can do right now is get vaccinated. And if you are vaccinated, get the booster. We have a resource guide posted right now for you on kpix.com.